we're investigating how California handles genetic material collected from newborns. Well, genetic testing companies like 23andMe, they have to get your permission before they store, use, or sell your DNA.
But your state government doesn't. And California stores DNA samples from every baby born here. And in response to our decade-long investigation, lawmakers are pushing for transparency.
CBS News California correspondent Julie Watts joins us now to explain why they face an uphill battle at the Capitol.
Yeah, guys, we started investigating this issue back in my early days as a reporter here at KPIX. And then I moved on to Sacramento and continued investigating it there. Listen, if you're even related to someone born in California since 1983, a portion of your DNA is likely in the state's massive newborn genetic biobank. But now, after a decade of reporting on this issue, the state is suddenly refusing to tell us who else has access to those samples. And we know the biobank is saving lives, but it's that appearance of secrecy that is raising concerns.
He was very, very cute, very adorable baby, and he has a lot of hair.
Ronnie's dad has wonderful memories.
Perfectly healthy.
Of seeing his son for the first time. What happened next was an afterthought. Like every baby born in the state, little Ronnie got a heel prick shortly after birth. His newborn blood filled 6 spots on a special card used to test babies for dozens of congenital disorders that, if treated early enough, could prevent severe disabilities or death. A couple of days after taking their seemingly healthy boy home from the hospital,
We got a call.
they learned Ronnie's heel prick revealed a rare genetic disorder called SCID.
He was diagnosed with no immune system at all.
It's known as the bubble boy disease. Ronnie's first infection could have killed him. Instead, he was rushed to UCSF, where he received life-saving gene therapy and where he met Dr. Puck.
I could never have developed a newborn screening test for SCID if we hadn't had stored dried blood spots.
Dr. Puck created the test that saved Ronnie's life. It was the first developed using extracted DNA from leftover blood spots stored in California's massive newborn genetic biobank. You see, doctors only need a few spots for the baby's own life-saving genetic test. The rest becomes property of the state. California has been storing blood spots from every baby born here since 1983 and can now test newborns for more than 80 rare disorders, thanks to research using those blood spots. California's amassed the largest stockpile of blood spots in the country, one of only a handful of states that stores them indefinitely without asking for parents' permission.
Were you aware that the state was storing your child's DNA?
No.
Do you think you should have been aware?
Absolutely.
And therein lies the concern. Instead of getting permission or letting you know you can opt out of storage or research, California sends you home from the hospital with a pamphlet and points you to a website with more information.
I feel like that's something that should have been discussed with us in person.
Everyone who came into our room gave us another pamphlet.
Blood is inherently or intrinsically personally identifiable.
Public records we obtained in 2010 revealed blood spots are also used by law enforcement. We found at least 5 search warrants and 4 court orders for identified blood spots, and that was before the Golden State Killer case made genetic genealogy a common law enforcement tool. Since then, from cold case murders in California to a cold case rape in New Jersey, law enforcement is using blood spots to solve crimes committed by parents before their kids were born. But when we recently asked the California Health Department for an updated list of research and law enforcement requests, the agency denied us, saying it's no longer tracking that information like it used to, and it's not required to create a record telling us who has access to our DNA.
What are they trying to hide?
From consumer watchdog's Jamie Court to genetic detective Cece Moore.
People have the right to choose how their DNA is used and how their children's DNA is used.
For years, everyone from privacy advocates to lawmakers have warned California's secrecy could ultimately harm the biobank. Several states have had to destroy their blood spots after being sued for storing them without consent.
That's a travesty.
And many believe California's biobank could be next.
We need to find ways that parents can consent without harming research.
And that's what some lawmakers have been trying to do. In fact, 3 different Senate committees passed a bill last year that would give parents the option to opt out of storage and research before the state stores their child's DNA. But the full Senate never got to vote. Why? Money in politics. You see, the state health department claimed it would cost millions to give parents that right. So the bill was sent to something called the suspense file, where in a budget deficit, expensive bills go to die. Even though, and this is important, it wouldn't have cost taxpayers a dime because researchers pay for the program. So now there are two new bills. One, prompted by our recent reporting, would require the state to publicly disclose who's using California's blood spots. The other would require the state to get your permission before storing or sharing your DNA, just like consumer companies already have to. But the powerful medical lobby worries too many parents would opt out if given the choice.
Rona wouldn't have existed today if the treatment was not there.
Ronnie's dad supports parental consent and the biobank.
That's the key here.
Thanks to other babies' stored blood spots, Ronnie's not only surviving, he's thriving.
Now, you do have the right to learn how your own child's blood spots are being used. We've posted a link on our website, KPIX.com, and you can go there and find out how to ask the state exactly what your personal child's blood spots are being used for. The last time I checked was back when I worked here, and they told me that my child's blood spots had not been used, but that was several years ago.
And you're just hoping if they are using it, you're using it for good.
Right. And
You're aware of it.
It really, I am aware of it. I am allowing them to store my child's DNA, right? So that is my choice. I think the concern is from parents who had no idea it was being stored and they didn't have that choice. And so just having that right, I think, is what a lot of people want.
Absolutely. All right, switching gears here for a minute because we're going to be seeing a lot more of you back here on KPIX. You're now in a statewide investigative role, right?
Yeah, I am super excited to be back here in the Bay Area in this new role. I'm going to be telling local stories through the lens of government accountability and in solutions-oriented journalism. And I really think that the folks here in the Bay Area will be shocked to learn how our state government is really working at the Capitol, or isn't working in many cases, to address the issues that matter here locally. So that's my goal, is to sort of be the eyes and ears for our Bay Area viewers in Sacramento.
Oh, we are so lucky to have you back. So good to see you.
I'm so excited to be back, guys.
Welcome back to the studio.
Oh, thanks.
All right, thanks, Julie.